Welcome. My name is Dr. John Miller, and I serve as the editor-in-chief of Psychiatric Times. A few days ago, on May 4th, the United States Department of Health and Human Services released a post from Secretary Kennedy talking about work groups that are going to be pulled together to evaluate and make recommendations to healthcare providers on an issue that they feel is a problem, specifically what they call overprescribing medications. And in addition to that, they bring up their goal of moving towards a more holistic framework in medicine in terms of addressing nutritional needs, in terms of exercise, in terms of social supports. And I have to be honest here. My first reaction to that was Secretary Kennedy sounds like he's trying to reinvent the wheel. I am 66. I started medical school 44 years ago. And throughout my 4 years of medical school and 4 years of residency and all of my years of clinical practice, all that I was taught and the way to evaluate and treat and manage and help all of my patients utilizes all of the various interventions that he brought up. And so I was perplexed at the disconnect. And I'm not sure, I don't know if it's related to the fact that he himself is not a physician or wasn't trained in medicine and isn't aware that the kind of issues that he raised are a part of our current good evidence-based clinical care. But I do want to make a few specific comments about this. So the first is that we as physicians, we take an oath to do no harm, and that extends to all healthcare providers, nurse practitioners, physician's assistants, therapists, etc. And our intent initially when we see a patient is to do a comprehensive evaluation. And as I always say, when I was learning, I was taught this, and as I teach, I impart this as an important paradigm that the first intervention is multimodal. And I may consider a medication, and if so, it will clearly be with shared decision making and a detailed informed consent. But in addition to that, I always get a history and then recommend that all of my patients consider some type of psychotherapy if it seems like it may help individual, couples, family, and there are so many different types. We also typically and routinely talk about nutrition, and nutrition is really important for healthy body and brain functioning. And, my message to Secretary Kennedy is this would be a great opportunity for you to lobby for increasing spending for feeding breakfast and lunches that are healthy to school children and to allow food stamps to access healthy vegetables and fruits and foods. So I think the good news is here we're all on the same page. The other issue that he brings up is exercise. And we know that depression can be treated with exercise if it's mild depression, and that exercise actually helps the brain become healthier. And so again, no real big learned information in his proposal. The one issue that I was a little disappointed that he missed was the importance of sleep hygiene. If we could help our patients get a good night's sleep, that would go a long way in helping their depression, their anxiety, their stress, and improve quality of life. And then, of course, psychosocial supports of all types. And we try to do the best we can in accessing resources or directing them. And then, if indicated, we think about a medication. And the goal is the lowest dose of the fewest medications for the shortest time. And depending on the patient and the diagnosis and the complexities, those variables can vary tremendously. And so I wish it was as simple as an algorithm that it sounds like they're going to try to create. But I'm proud of the fact that the medicine that I was trained in the 1980s, in my residency, and all of my continuing education since then, has been inclusive of a wide-ranging and comprehensive intervention that certainly includes medication, but certainly not overprescribing and certainly not to the neglect of all of those other areas that I agree with Secretary Kennedy, like nutrition and exercise and social supports, are really important. So, Secretary Kennedy, if you can hear me, I think we can find some good common ground, but maybe we need to talk. And I think that conversation goes a long way in helping both parties understand what the needs are. And you are in a really good position to help us advocate for improving our patients' access to treatment, to nutritional resources. Let's build more playgrounds and access to gyms. Let's educate about sleep hygiene beyond the office. So I think that we can accomplish a lot of this. We need to work together, but first you need to understand, Secretary Kennedy, what we already are doing. And so I thank you for inviting this conversation. So thank you for listening. And as always, we will do our best to keep you informed here at Psychiatric Times. And so you be well, take care, get a good night's sleep, eat good food, exercise, use your social supports. And if you're on a medication, take it as prescribed and continue to talk to your prescriber about it. Thank you.